welcome to the Renewed Nurse Podcast. This podcast is all about nurse well-being and is brought to you today from the Center for Nursing Excellence at WVU Medicine. My name is Melanie Houston, and I'm the Chief Nurse Executive for WVU Medicine.
Hi, my name is Allie Dempsey. I am a nurse working on 7 West at Ruby Memorial Hospital, and Melanie and I are your hosts on the journey to discover nursing well-being.
Well, we had our first introductory podcast, and so the one thing I would tell you, it's been really fun, and I loved working with you, but this is a way to really get to know you. I saw you taking care of patients, and I was able to help you, but it's been really good to have this time together.
Yeah. It's nice to have that one-on-one conversation, too. I think we all need to do that a little bit more and recognize what's going on in our lives every single day. We talked a little bit on the first episode about putting ourselves first. One of the first questions that you asked me, I immediately related it to patient care. And I think, throughout all of the episodes, it's really important, for our viewers to ask questions in the moment, give us that feedback, because at the end, we're going to have a little bit of a questionnaire and we'll be able to actually respond to that feedback in live time.
We want to hear from people that are listening and watching us. But the one thing we're going to do is always kind of bring back to the Maslow's hierarchy of needs. If we don't take care of ourselves and have basic needs, we're not going to be good for our families, for our patients, and for each other.
All right, and we are going to welcome Joe Slavik. He is the director of the Howard Long Wellness Center, outpatient diabetes program, and an exercise physiologist. Also one of the cardiac rehab directors. He started in Dayton, Ohio in 1990 to 1993, and that's when he came to Wheeling. So nice to meet you, Joe.
Nice to meet you guys, yeah. Glad to be here.
Well, for those who aren't working in the Wheeling area, what is the Howard Long Wellness Center?
Yeah, the Howard Long Wellness Center is a comprehensive hospital-based wellness center. We've been around for 31 and a half years, part of Wheeling Hospital, and it is anything you can think of in a health and fitness facility we have there.
Wow, that sounds great. So help me understand a little more about what you do, what kind of innovation, just tell us what's open to the staff.
Yeah, so we've always had membership for the Wellness Center for employees. We're open to the general community, but probably about 1,000 of our members out of the 5,600 are hospital employee associated members. And that probably represents individually probably about 575 to 580 employees.
Wow.
So we've always discounted our employees for their membership, for their family and so forth and so on. But just recently, we were able to innovate through really the support of our CEO, Doug Harrison. We're able to create an incentive program to allow our employees to be more access. And so what it is basically, we've made an agreement with them. If you visit 8 times or more in any given month, the following month, you'll have no charge.
Wow.
And that's also eligible to their spouses or any dependents that they have. So it's really an opportunity to have some skin in the game. So if you don't get those visits, you're going to be charged. And so it incentivizes them, and it makes it for a healthier employee base.
It sounds good. So as a nurse, I know fellow nurses are going to ask me, what does that mean? What are we doing? So Tell me a little bit more about that.
Yeah, so what you're basically having an opportunity to involve yourself in physical activity. We know from the research data that if you're physically active, your disease risk for diabetes, heart disease, hypertension, certain types of cancer really, really goes down. And so then when you get folks into that, when they really got themselves engaged in the process, they start to look at the rest of their health. They start to look at what's their weight look like, what does their stress levels look like, and they incorporate these other healthy lifestyles. So it's kind of a synergistic benefit that the employees get to take advantage of.
So how long has the center been around?
Yeah, actually 31 years. We're going to be 32 years old in September. It's really an outgrowth of our cardiac rehab program that we had.
Makes sense.
We're the oldest cardiac rehab program in the state of West Virginia. And in fact, the hospital just graduated to its 175th year of employee healthcare in the community. And what we've done is given them an opportunity to really integrate themselves into a process that gets them a healthy lifestyle.
Well, I'd like to hear more about it, obviously. The last episode that me and Melanie, we talked about well-being and how that kind of impacts nurses and what well-being means to both of us,
Right.
Physical and mental capacity. So how do you feel like that impacts nurses?
Yeah, so I think what we really want to try to do is make sure that the nurses are educated about those benefits because they're doing everything else. They have lifestyle issues that are associated with dealing with family members that are older and younger. And then the employees they have to deal with the patients. So we really want to educate them and then promote the incentive program that we have so that they can incorporate these lifestyles, and then that improves their overall stress.
Right, because nursing doesn't always lend itself to the healthiest lifestyle,
No,
right?
it's not.
Very difficult.
They're busy, there's a lot of snacks on the unit.
Right.
Sometimes they're not the healthiest kind of snacks. People who work days, people who work nights, not sure when they want to eat. You know, I remember being there on the unit and there was just donuts, right? And all kinds of snacks. And so I'm hoping that's a little healthier these days. I don't know, Allie, what do you think?
I mean, there's definitely an occasional pizza party. So that's for
That's
sure.
okay as long as it's occasional.
Right.
Now, and that's what happens when people start to incorporate this. They start to think about, okay, what am I eating? You know, where am I? What choices am I making? And you know, they really have to contemplate to think about how this fits into their lifestyle. Because if you really want to take action, where does it fit? You know, how does it do it? And what we find out is the folks that really incorporate it in their lifestyle, they know where it's going to be in their schedule, and they have a buddy system that someone else is accountable to, so that when they don't feel like working out, doing these, somebody else is there kicking their buttons, and vice versa. So those are the two most important factors that we've found over the years.
How many nurses would you say are involved in this?
You know, it's hard to tell because we don't track nurses exactly, but I know it's probably approaching 100. Yeah.
I feel the same way. I work out at Orange Theory, and when me and my husband go together, it makes a huge difference. And I have to say that I've really only incorporated health and wellness a little bit later in my life.
Right.
And if I had to do one thing over again, I probably would have done it a lot earlier, because it feels like, to me, you just got to make the time.
That's right.
We're all busy
That's right.
with our kids, with our life, with our school, and you got to figure out the time. Right?
There's no question, and it's never too late to start.
Right.
So it doesn't matter what age. We've actually done research studies where people in their 80s and 90s have never exercised for 30 or 40 years, and they start to accumulate those benefits, of the health benefits, after several months of working out.
Now, you're not saying I'm close to that age.
No, I wouldn't say that.
How do you feel like nurses are keeping each other accountable? Like you said, it's the buddy system.
Yeah.
You know,
Yep.
do I feel like that would always work for me? I'm not sure, because would I slack with my buddy? So I'm not
Yeah,
exactly
that's
sure.
interesting. Now, it's funny what we've seen so far when we started this incentive program in October. There's a little bit of competition. So
That makes sense.
how many times did you visit? And how long was your visit? 'Cause we're actually tracking the length of their visit. They have to have at least 30 minutes within the building. We're tracking that as well. And so it's interesting because there's a little banter going back and forth on the floors and in other departments within the wellness center and the hospital.
Would you see the trend going? Because I think COVID, the trend probably went down,
Significantly.
right? All the gowning and gloving and how it felt to be in COVID. And,
Right.
you know, wouldn't you see that would have been really hard to get time to do that? But are you seeing an uptick?
We are. We're almost 5 years post-COVID, and we're probably about 95% of our maximum number of membership from that time period. So we're basically back to ripping and roaring with physical activity.
Yeah.
So tell me a little bit how people know about it at Wheeling, and, you know, kind of how's that promoted?
Yeah, so a couple different ways. We have digital boards throughout the hospital that were promoted, and this particular program that we started in October is promoted. And I go to every hospital new employee orientation.
Okay.
And I explain to them the program and the opportunities that they have, because it's really a fantastic opportunity. And it's very unique, even in other corporations, that you have a situation where you're actually being able to go free if you're actually using it. Use it, and there's nothing going on. So it's a little skin in the game, but it works.
Now, is there a way for the nurses to get the same kind of benefits while working, or is there any activities that they do?
Pretty difficult on the floors. Now,
Right.
we do a lot of outreach to nurses,
Okay.
during particularly Nurses Week. We'll do a lot of chair massage, which is really important. I know, that 10-minute pause, how important that is to de-stress. We use chair massage a lot during that week to kind of incorporate that opportunity for them to calm down, relax, de-stress, and then get back at it. So we use that a lot, and then we use that to promote other activities within the.
No, that's
the program.
awesome. I mean, we all ideally would like to say that I want to get a massage every day after work.
Yeah.
That would be the great thing. But if I could get it, during Nurses Week,
at 10 minutes, it's amazing
really
how much a difference that 10 minutes
just to de-stress for
Yes.
just a few minutes and
Exactly.
take away from patient care. So that's awesome.
Well, the other thing about it, Allie, is the evidence does show that even a 10-minute break really makes you come back refreshed, feeling like you can tackle the rest of your day. And it's hard to say, like 10 minutes really matter. I mean, the optimal is 30 minutes,
Right.
but the evidence does show, because everyone says, I'm too busy. I can't do it, right? Like, you barely some days have time to go to the bathroom, but you gotta step away. You gotta find that time. And just like we said before, you gotta make the time.
That's exactly right. And it's not just that it's good for their productivity, it's actually good for their mental health.
Yeah.
Right.
And that's really what you struggle with, because there's so many stresses and people having to pull doubles or staying overtime because, there's a lack of staffing, and, we've all suffered with that. So it's really important. It's really important. Actually, Winston Churchill took a nap for 10 to 15 minutes during the entire war. So you're talking about an opportunity to just bring it down so you can get back up.
Just a reset.
Yep.
Yeah.
Yep.
I agree.
Last time we talked about how well-being, we always think about our, patients, right? And, when we think about our patients, if we come back refreshed, we are really there more for the patients.
Absolutely.
Well, the other thing too, this is a nursing podcast, but we care about everybody.
Absolutely.
This tips and tricks are really for nurses because we worry about them and how they're doing. They're the largest segment of our workforce.
Absolutely.
But, this is tips and tricks for anybody, wouldn't you say?
Right, absolutely. In fact, there's a breathing exercise that we use a lot for people to de-stress. And it's people call it box breathing or rectangle breathing, but basically it's a circumstance where you're trying to activate the parasympathetic nervous system. Okay. So the vagus nerve really calms you down. So you go to a situation where you're actually inhaling for 4 seconds, you hold for 4 seconds, you breathe out for 8 seconds, and then you hold for 4 seconds, and you just keep repeating. And that activates, if you do that for 5 minutes or longer, usually 5 minutes will activate it, that actually calms you down. It lowers your heart rate, lowers your blood pressure, lowers the stress in your body.
Yeah, I think that would be easy to incorporate.
Absolutely.
I mean, it just takes, like you said, 5-10 minutes to reset. And I am definitely a victim of that. I mentioned in one of the last episodes too, I wear a Dexcom. And it's very easy for me to silence my Dexcom and then go and give somebody else an insulin shot. So it's very much, you need to take accountability for yourself. And, I think that's going to help ultimately patient care in the end. Like I said, we do forget about ourselves a lot, but my goal to be as a nurse is to help my patients as best as possible. That's why I want this job.
And if you're taking care of yourself,
right,
you can take care of not only your family members, but your patients as well.
Right. And I think you'll go home happier too.
Yeah, for sure.
Yeah.
And we could teach that to others. So one of the things we always close out, because we kind of do a debrief.
Yep.
And so I want to ask you, how are you feeling about our talk today?
I think this is a great idea. I'm super excited you invited me to be part of it, because I think it's a wonderful opportunity.
Well, a little about Joe. Joe has done multiple podcasts. He's popular in that sense. And Melanie and I are brand new, so
you're doing a great job.
We're excited
Absolutely.
to talk with you and excited to learn more.
Yeah. Why don't we take a pause and do one thing? So show us the box breathing before we go. Okay. That would be helpful. We'll give it a try.
Very, very simple. Okay, so what you're going to do is you're just going to sit in a comfortable position, relax shoulders, and all you're going to do is take a deep breath in for 4 seconds. Go ahead. 1, 2, 3. Hold it. 1, 2, 3, 4. Now breathe out for 8 seconds. 1, 2, 3, 4, 5, 6, 7, 8. Hold. Hold. 1, 2, 3, 4. And inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. And now slow exhale for 8 seconds. 1, 2, 3, 4, 5, 6, 7, 8. Do that for 5 minutes. You will be relaxed. The 8 seconds is a little bit more difficult.
Write it down.
Some people do 4, 4, 4, 4. The 8 seconds is actually you're trying to empty everything out, and it does activate that vagus nerve a little bit.
Yeah, well, you forget about everything else.
Yes.
I'm worried about counting to 8.
Very good.
Well, I'm going to have to try that.
Yep.
And so we thank you so much for coming and sharing that. That's a
Absolutely.
really good example, something you could do right
5
away.
minutes right at the desk.
All right. So Allie,
Yeah.
who are we talking to next week?
Sarah Hollins is going to be our next guest. She's the Director of Behavioral Health Services from Camden Park. So we're excited to hear about how she can give us ideas to create that safe place and kind of area for well-being in the workplace, both mental and physical. So.
Well, thanks, Allie. Thanks, Joe. And I'll see everybody next week. Thanks again for listening. We look forward to this journey together. I'm having a lot of fun, and I'm hearing all kinds of feedback that I can really incorporate. But as usual, if you have any inquiries, questions, you can reach out to me directly. Again, I'm Melanie Houston. I'm the Chief Nurse Executive for WVU Medicine. And you can reach me via email at Melanie, MELANIE, .Houston, HEUSTON, at wvumedicine.org. And thanks again for listening.
This podcast and video presentation were brought to you by the WVU Medicine Center for Nursing Excellence. For comments, questions, or suggestions, please email melanie.houston@wvumedicine.org with the subject heading Podcast Feedback. This program was executive produced by our Chief Nurse Executive, Melanie Houston, and developed and produced by me, Eric Small, with the Center for Nursing Excellence. Multimedia production and recording is by Chad Atkins. Our logo was designed by Carly Kale. We want to raise a special thanks to all of our partners in the marketing department at WVU Medicine for their work on this project, and to the nurses who dedicate so much time, effort, and care for the patients of WVU Medicine. Thank you.